Welcome, you're watching South Africa Tonight. The World Health Organization is calling it a knee-jerk reaction. The South African government says it's being punished for being proactive. Numerous countries have issued travel restrictions after South Africa announced this discovery of the Omicron COVID-19 variant. It's caused chaos for travellers as flights are suspended or cancelled. Futurist and strategy consultant Graeme Codrington speaks to us now. Graeme, thank you very much for your time this evening and for speaking to us. So your daily bread is strategic insights. Give us your insights, if you will, onto how the global reporting and messaging around this new Omicron variant has gone horribly, horribly wrong, essentially scapegoating South Africa when we should be praised for being proactive.
You know, this isn't the first time that this happened. Back when the Delta variant was taking off around the world and we were dealing here in South Africa with the third wave, there was a very similar approach. And I think that around the world, it's just an easy headline if you reference the country that first identified a particular variant or came up with the insights as to what's happening with the virus. And of course, here in South Africa, we have remarkable epidemiology. We have a lot of people who've spent their lives studying infectious diseases because of HIV and TB and sadly some of the other diseases we deal with every day, every year here in South Africa. But that puts us at the forefront of science globally. And I think other countries might have similar capabilities, but they maybe keep that information to themselves. I think we as South Africans know that the best thing to do with public health is to make everything open, be very transparent, explain everything to everybody. And as you say, now again, not only a few months ago, but now again, because we've done that, the rest of the world tends to think that this particular new variant comes from South Africa rather than just being discovered in South Africa. And I think that's quite an important difference.
Absolutely. Graeme, do you think the rest of the world and perhaps even South Africans themselves underestimate how advanced our scientific and medical epidemiological community is?
I certainly think internationally people don't recognize what we've got here in South Africa. This is what I do for a living. I'm not a doctor, I'm not a medical professional, but I'm a scenario planner. And obviously for the last 19, 20 months, I've been really focused on trying to understand COVID and the scenarios, what might happen next. And when you listen to some of the experts, podcasts and news media internationally, especially in America, I think, you know, they've been talking, for example, one of the things I think hopefully will now happen is we need to release the patents for some of these vaccines so that we can produce them locally and we can produce them at a much lower cost in the system. And I've heard people internationally kind of wonder out loud whether anybody on the African continent has the ability to actually produce these medications, not knowing, of course, that South Africa already has existing plants that are producing medications for the EU and vaccines for the US. So I think it's just ignorance. I'm not sure it's willful ignorance, but I think often Africa is just seen as the dark continent and written off as if nothing good happens here. Whereas, of course, we know, those of us who live here, just how much innovation, creativity and advancement there is, especially, I think, in the medical field.
Graeme, we're all kind of rolling with the punches and learning about very, complex scientific issues as we go along. So perhaps South African media have, inadvertently been complicit in creating this misconception that it's a South African variant by saying exactly that, the new South African variant, instead of saying the new variant detected in South Africa. And over the last couple of days, I think we've seen media make that distinction here locally to try and make sure that our South African public also do not head into a state of panic, knowing that this is also being found across the globe. So what do you think we should do going forward? Because that's the next step. We can't, wallow in what's happened perhaps over the last couple of days. We need to move forward. Do you think a strict, harsh lockdown is the way to go?
You know, this one is a difficult one because I think the Delta variant, the previous one that was first detected in India, here in South Africa, had a few strains in Brazil, seems to have developed independently in different parts of the world. Whereas this Omicron one, and remember, the information we have is only a few days old, and our scientists only identified it about a week and a half ago, and have been working to understand it and then release the information as soon as possible. So we don't really know as much as we should. I'm pretty certain we're going to see other countries now begin to identify it in their countries now that they know what they're looking for. Our South African scientists have sort of shown them what to look for, and I'm sure they'll find it. But there is a problem here. As far as we can tell, this one's a pretty serious variant. We don't know yet exactly what this variant will do. It looks like it's probably more infectious, but we're not entirely clear yet. It looks like it might be able to bypass at least some of the vaccination protocols. Not all of them. That's the good news, early good news now. But we don't know, right? And so it's probably the right thing to do to overreact just a little bit. I think maybe there's been too much overreaction, and of course a lot of people have been caught up in this travel ban and overreaction. I don't think that our government will. Personally, I think our government has, on the whole, done reasonably well here in South Africa with managing these various waves. My guess is that we're likely to see a warning shot from government after their meeting today, where there might be maybe an increase in the curfew, maybe just a restriction on some hours of trade, maybe for alcohol. But I don't think we'll go into a full lockdown yet. I don't think that the numbers of infections are there, and it'll give us a few more days. With this particular variant, I think a few days will make all the difference as we watch it, as we give time to the scientists to understand it more. If it is a really bad variant, we don't know that yet, but if it is, then we'll be grateful that we acted quickly and that we stopped the spread. But in the end, you can only slow it down. And the reason for a lockdown and the reason for a travel ban is not that we stop COVID spreading. It's that we give ourselves time to prepare. And in that situation, I think in South Africa, it would be giving ourselves time to get more people vaccinated.
Graeme, I want to pick up on something here, once again, going back to the messaging. You said a very interesting thing that other countries around the globe are likely to start picking up cases of Omicron in their own countries. And I want to look at the messaging specifically around that, because currently in global media, a lot of that messaging is related specifically to travellers. So lots of reports of 61 travellers heading from South Africa to the Netherlands testing positive, a traveller heading from Malawi to somewhere testing positive. So once again, Africa being blamed as the origin. Do you think they're only picking up this Omicron variant in travellers because that's the only place they're currently looking? Or are there likely to be more cases identified as they start tracking and tracing for this specific variant among their own population?
So there are two scenarios. The one scenario is that the variant did in fact originate probably in Botswana, as far as we know, then came through to Pretoria with one student who came back and brought it back. And it might be that that is the origin, and that we already have traced it back to the one person where it came, and now it's spreading around the world. So that may be the scenario, and that's why we're beginning to find it in travellers who have travelled. But of course, there might be other people who have travelled before Thursday who have taken this variant with them. That's one scenario. The other scenario is that this might be similar to Delta, where the mutation that has taken place is a fairly obvious mutation and might have happened in multiple places in the world. And now that other medical countries around the world, that their medical teams can start looking for the types of mutations we can see here in Omicron in South Africa, they might find it as well. Both of those scenarios are possible. We just don't have enough information at the moment.
Well, thank you once again for your insights. That was futurist and strategy consultant Graeme Codrington.